Guys, we have the next type of hematuria to actually look at. And this next type of hematuria is what we call the intermittent hematuria. Intermittent hematuria. Now, when they say intermittent, what do they mean? This simply means occasional. All right. So, hematuria, guys, everybody know that hematuria is basically the presence of what? Blood in urine. Okay. So if it is intermittent now, that means what? Sometimes the patient actually has presence of blood in urine, okay, but not always. All right. So we'll be taking this disease condition, we'll be looking at the definition, look at the causes, look at the characteristics, look at the possible evaluations. They'll look at the management for this. So this intermittent hematuria actually refers to what? Occasional presence of blood in urine, okay? And this may come and go over some time, all right? What are the possible causes of this? It could be that there's kidney stones or gravel. It could be that there's urinary tract infections. It could be that there's a prostate issue like prostatitis or benign prostate hyperplasia, right? It could be that there are some bladder tumors or cancer, okay? It could be that there's kidney tumors or cancer. It could be that there's trauma or injury to the urinary tract. It could be that the person is undergoing some medications like anticoagulants, aspirin, and the rest. It could be that there's some inflammatory conditions like interstitial cystitis, right? What are the characteristics? This type of hematuria occurs sporadically, right? So that means sometimes the person will be having urine in blood. Sometimes the person will be having normal urine, okay? So it's just sporadical, okay? It may be triggered by specific activities like exercise or heavyweight lifting. The urine may appear normal before episodes of what? Hematuria, okay? Then evaluation, just to dictate the condition, confirm that the condition actually exists and all that, right? You might want to do a urinalysis test to dictate hematuria. You do urine culture to rule out infections. You do use imaging studies like what? Ultrasound, CT scan, just to visualize the urinary tract, okay? You might also want to do a cytoscopy to examine the bladder and urethra, right? Then you do some blood tests just to assess kidney function and rule out other possible causes, right? What are the possible management? You might want to treat the underlying causes. If there's something that is causing this type of what? Blood in urine, you might want to treat it, all right? Like for example, use antibiotics if it is a urinary tract infection, right? You monitor kidney function and urine output. You address related conditions, like if it is a prostate issue, you address it, okay? Then you refer the person to a urologist or a nephrologist for specialized care. You follow up the person to ensure what? Resolution of the hematuria, okay? Just make sure you follow up the patient till the problem is actually what? Eliminated. So this is it for what? Intermittent hematuria, basically from the cause, characteristics, evaluations, and what? Management. All right? See you guys.